Kia ora. I'm Rawiri McKree Jansen and I'm the Chief Medical Officer for Te Aka Hauora. Pertussis is a terrible disease. It causes coughing fits, and in adults it's really frustrating, and sometimes it's called the 100-day cough. But in babies it can be much worse. It can stop babies from breathing. Babies can die. Today I want to talk to you about how we protect our babies from pertussis. We can protect babies by immunising. And the first group that we think about immunising is hapū māmā. So if pregnant women get immunised against pertussis, it protects their baby when their baby's first born in those first few months. Babies start their immunisation at 6 weeks. So getting pregnant women immunised protects baby until they start their vaccination. But at 6 weeks, it's really important to start protecting our babies by getting them immunised. So whānau, if you can, get your babies started on their immunisation at 6 weeks, on time, or at least as close to on time as you can. Adults can also get immunised, and so at age 45 and 65, pertussis vaccination is available to adults. So whānau, protecting our babies is something that we can all do together, and if there are babies in your whānau, being immunised is a really great way to protect them.